We will move on now to Georg Khevenhüller's presentation. I'm very happy to be able to speak with him and allow him to give you a firsthand understanding of the great work being done in Germany. It's obviously one of our most active associations and has tremendous activities throughout the country and throughout the world. So without any further ado, I will just remind you that the session is being recorded, and it will be available for you to send those people in your associations who haven't had the opportunity to hear it firsthand. And we will be muting all of the microphones automatically as we begin the session now. But you have the control on your own devices to unmute yourself should you have a question or you'd like to interject something. I'm sure Georg would be very happy to answer any questions you might have or clarifications along the way. After he's finished with the presentation, he has so kindly furnished that we've sent to each of you in advance of this, this Zoom conference. There will be plenty of time for question and answer also. So with that, I will ask Georg to give us an understanding of what life is like right now in Germany and how the order has been responding.
Lisa, thank you so much for the opportunity to give a little bit of an impression of what's going on in Germany. And again, from me, I only see perhaps 20 here on my laptop, but I guess there are much more people, much more of you joining this video conference. So I just wanted to greet everybody and say thank you that you have joined this meeting and that you are interested in hearing what we are doing in Germany. And before even starting this presentation, I just wanted to say, please never be impressed by any figure or number you might see or might be part of my presentation, because it's not a question of the size of what's happening here. It is more about what were we able to do out of the situation. So don't be impressed by anything, but challenge and question what we are doing and whether we do it properly or not. And also I'd like to ask you to give us your advice if there is anything we could do better, because we all live from everyone's advice in doing the things better to accomplishing with our mission. Yes, you might have received this presentation I did, and if I may ask you to go a little bit side by side through this presentation. Well, yes, a little bit to me personally, but this is not really important, that we can look after later on. If I come to the slide number 3, and yes, it's situation in Germany. There you see some figures concerning the confirmed cases, the death, the occupied intensive care beds and the non-occupied intensive care beds. And on the other side, you see a little bit the measures taken by German government. And you may perhaps ask, how is it possible? If you compare that to other countries, the numbers were very different to what is seen in Germany. And I just want to give some explanations why the numbers in Germany might be different to other countries. First of all, Germany could learn from the others. If you imagine how the coronavirus spread around the world, so there were already some countries having experiences before it came to Germany. So Germany could learn from others, also good things, but also bad things. So this is for sure one of the reasons why Germany was in a quite a comfortable position. The other thing is when the pandemic came to Germany, there was an overall knowledge already, which was day by day increasing. So each measure Germans and German governments took could be were much more accurate and much more precise on the specific situation, because we were able to learn. Another point might be that Germans are by culture and by their nation, they are a very obedient culture. So when Mama Merkel says something, most of the people really, they follow what she says and follow her instructions. And this is why perhaps all the lockdown and shutdown measures which were given by the government were seriously considered and kept. Another reason is for sure that German, by the way it is positioned, has a pretty high capacity of intensive care facilities, higher in comparison to other countries, with about 27,000, which is about 30 beds per 100,000 citizens. This is a pretty high number. So we were not so much under pressure like other countries. And the last point for sure, and this is very, very important, but also here again, we were just taking advantage that we waited in other countries facing this pandemic, the number of tests. And when we started, the tests were not that high, but very quickly we were able in Germany to rise the number of tests. And today we are at about 300,000 tests per week. And by the end of April, we want to have reached 1.5 million per month, which would be almost 350,000 tests per week. And this for sure gives Germany a comfortable position and helps to very early separate people who are infected and get back people who initially had to be sent into quarantine, and then they can come back and rejoin whatever is necessary. If we go on to slide number 3, and I think this perhaps is one of the main reasons and decisive issues why we are where we are today. And on one side, it is we may have a very, due to our size, a very extended team spirit among all the responsible leaders and managers. And so we are, it's easy for us to rely on each other. We are very keen in delegating responsibilities among us, among each other. And having said that, we were able to establish this emergency task force and pretty early. And the second issue is perhaps communication. There's nothing more important in a moment of insecurity, of anxiousness, of whatever, that you have to be very, very close in touch to everybody. And only then staff, volunteers, members see that you are guided, that they are well guided, that the different actions are coordinated. And we have to thank also, because we actually started mid of February with the preparations after we received the letter of the Grand Chancellor, when he was asking, already mentioning that coronavirus is coming and if we are well prepared for that. Perhaps so all of that put us in a position that we were then pretty quickly able really to act and not to just react. We were really able to act on the specific questions and challenges. If you go on to slide number 4, you see the works of Malteser in Germany are, yes, they are quite, it's a huge variety, and it's now not the moment to specify the legal organizations, but it is basically, we have on one side the hospitals and nursing group of nursing houses for homes for elderly people, and then we have schools and migration, and then we have the disaster relief and social services. And concerning the hospitals, yes, it is a sizable number, but it is also a problem, or it gives us a challenge we have to deal with. For instance, right now, Germany going back step by step or preparing to go back to normality, we face the strange situation that we have divided our hospitals into 3 different areas. One is COVID-19 suspected cases, one is COVID-19 patients, and one is COVID-19 intensive care patients. And all of these 3 departments are strictly divided and separated from each other. And now that we have to face that we will get back to normality, this is quite challenging, because the people they are not free. They are all bound and integrated in their departments. So taking them out there will loosen our capacity and flexibility in their departments. So yes, I just wanted to say that it's having this size is nice and it's beautiful, and it gives us a lot of opportunities, but it's also a lot of challenges day by day due to the changes in the actual situation. The same thing happened when we had to prepare for the hospitals just for intensive care patients. In the case of many affected people, we didn't have that many care and nursing staff. So we had to train our staff also for intensive care. It's something that you don't have in your normal life. So we had to prepare all that. So you see, there's always challenges and things we had to consider also in the hospitals as well as in the nursing homes. People were very uncomfortable when we had to strictly forbid visits. And but in the course of the time we learned, and we were also then able to provide tablets for video calls, to set up special rooms where the people in the nursing homes could then get in touch back virtually with their beloved ones. And even today, we are even preparing in some areas of the homes for nursing homes for elderly people, sort of cabins with huge plexiglass in the middle, where they can, with 2 different entries, where they can meet their beloved ones. It's things we are not prepared, so it took a time to get there. Another thing which was very important when we quickly learned, but we had to organize, was that our patients were asking for spiritual support. And even when they were really sick and already close to leaving, we had to get priests to administer sacraments and to give the anointing. So we had to prepare special kits for priests to come to visit, to spend the sacrament. Not everywhere, but at least in some places we could manage to do so. Another area is migration. You see on slide number 5. Yes, we have quite a lot of facilities for refugees and migrants. we continue to manage these homes. We do that in charge of the federal, state, and the provinces. So it's not our own facilities, but we do the management of these facilities. We take care of the migrants, and we are keeping them ongoing. But it also puts us into questions and difficulties. We know that most of the migrants in our areas come from countries where the people are used to stay together, stuck together, live together. So we are not a hotel with single beds and single rooms. We are facilities where we can put 3, 4, 5 people, families in 1 or 1.5 or 2 rooms. And if one is infected, it is very difficult for us to isolate this person and put it on to quarantine. So we are in serious difficulties to get more premises where we can put the infected migrants and refugees in order that they don't spread the coronavirus in the whole facility. So it is, everything we do is nice, but it's always then also a challenge, and we have to deal with things we perhaps before did not consider to this extent. Yes, we have some schools, we had to close them, and they are closed till now, but we are already thinking of opening these schools. We hope that by May we will start. So we are now already training teachers how to provide special hygiene and security issues for the schools, for the children, so that they can start teaching sometime in May. The shelters, we have some shelters for youngsters, which initially had to be closed, but then because of the critical situation, we reopened them very soon, because we know that they have come from very problematic homes and backgrounds. So we keep them open today, but it is not easy, because if you're dealing with people with some disruptions and difficulties, they are not so aware of the danger of which is outside. On slide number 6, yes, it's a little bit of what our civil protection and disaster relief is about. We have about 3,000 active volunteers. Their main task is the transport of the sick in case of evacuating nursing homes and hospitals. It has been dramatic in several cases, thank God not in our own houses, that nursing homes were affected by coronavirus and had quickly to be evacuated. And there we were highly in charge, because we had the possibilities, because we form part of the regional disaster relief organizations. And so we were able to go with our volunteers and get out the people, bring them to other places. And not only that, also in many cases, because of lack of care and nursing staff, we were asked to take care and nurse the elderly people, which our disaster relief staff is not prepared to. So we had quickly to set up a training course with 40 units online training for our staff, and so that they could also take care of the nursing of the elderly people, where in cases there were no staff available. This was a very serious issue, because it brought us into a new area where we were definitely not prepared to. But today we run quite a lot of places where we support when the nursing facilities in homes for not belonging to us, but to others where they had no staff. We were also involved in the construction of hospital extensions. I think in total, we were involved and prepared our staff to 30 places, but only 4 have been really erected by our disaster relief groups. The others are just in preparation to be used in the case they are needed. But by now, none of them is operative. But we are prepared in the case they would be needed. In the case they would be needed, we would take care of the entrance logistics of patients. So we would not take care with our staff from the hospital activities. We had a lot of drive-in testing sites and special fever clinics where our volunteers supported. You see that in this little photo. So you had to take samples from your throat and nose, and then just do the logistics to find out whether the patient is infected or not. In total, over 50 sites where we were, but interestingly, basically in the south of Germany, not in other areas, but there it was a big issue where we involved. And today, another very important issue of our disaster relief group is the logistics hub. We have a central purchase department close to Cologne, and from there we have to distribute everything into the areas. So we have 5 logistic hubs where our local units are taking care of the distribution of masks and every protection stuff what our volunteers and employees need. On slide number 7, we see a little bit what the social services are about. And that was, yes, it's nice. There are many new initiatives came up. It's interesting that in a moment of such a worry, of such a catastrophe, how many people all of a sudden start and come up and say, well, I'm here, what can I do? How can I help? And where can we, so we have to design with them areas where they can be involved. So we have had many new volunteers coming to us, but we have also received lots of good ideas to set up new services. Simple things like visiting by telephone. I guess most of you are doing that, but also shopping aid, but also simple things like a dog walking, a pet walking service. People don't know it. And there is an elderly person who has a dog or whatever, a cat, and she doesn't know how to handle that. So, and you really take a problem from her if you give her a hand and organize that. But also naturally medical aid and food for the homeless. It's a serious problem also here in Germany. Soup kitchen for homeless. Normally the homeless, they have a, Maria knows that because we're doing that, we did that for a long time in Buenos Aires, but they are special personalities. They don't want to live in a place, they don't see the fear and the problems which may arise from any infection. So they live their life, but they need some food. And it was very difficult because most of the food kitchens had to close. And so we had to negotiate and with the different municipalities. And one of our vice presidents, Albrecht Kroy, was very keen and hard negotiating with the municipality. So we could open several soup kitchens. We could find some organizations who would provide the food, and all of that all of a sudden worked. So we have today several places where we can manage soup kitchens 3 times a day. and people have, yes, our guests have accepted. It takes a while till they accept, but all of a sudden they may accept, and then it's a well placed service we can provide also to give some additional help. But also other things like a sewing instruction for making face masks. That was an initiative of Vice President Daisy Bernstorff, who started an own podcast with her showing how to sew a face mask with her sewing machine and giving step-by-step instruction. And quickly, many of the volunteers started sewing face masks. And so this is something where many people all of a sudden could be involved in a good and important service. Another issue which I think is very important, and I would like to talk about also, because at the end of the presentation, when we talk about the lessons learned, is the whole area of spirituality. And we have seen that that many of our volunteers, many of our employees, and definitely also people from outside, patients, they were pretty alone and lost and did not have sufficient information. And they were scared. And so we implemented quickly a general helpline or hotline for all items, for all issues around Corona. So everybody could ask whether it was a medical or clinical question, but also some practical issues. And we would help them and give them, at least try to help them and give them a solution. Then quickly we understood that also our employees and our volunteers, that it was very challenging for them, the dealing with the patients, the seeing the needs. And so we set up a pastoral hotline for employees and volunteers, so that we have, because of our disaster relief groups, we have also psychosocial relief care. So we were able to give them also psychological support when they were in serious distress. And a third element of this is that we gave also a hotline which we linked to the different services in the areas for pastoral care, for problems with children and teenagers, for women in distress, but also for parents which were hardly affected because they were no longer used to take care all day long of their children. All needs which we then tried to address with a general hotline, and then passing it over to a specific, specialized and trained person. That helped a lot and was highly accepted. That was something we did not have previously, but we had to set up quickly after the crisis began, and today it is very well accepted. And another, in this connection, another point was that we understood that people felt amazingly alone. They could not say farewell and goodbye to their beloved ones when dying out of Corona or dying for another issue. They could not have a funeral. They could not attend a service. So we set up a virtual mourning room, and which gave the possibilities and not only the time for mourning, but also an area to deal with the dolor everyone had, an area, a special place for consolation. Also perhaps just a moment of silence with a prayer, with a memorial page, a condolence book, or appropriate text we have seen that how that is accepted and how that is needed. And that was a very important element of our strategy when dealing with this critical and serious situation. Yes, in these past 6 weeks, we see that we have highly incremented our coverage in the local news and in the press. This is due to, naturally, because the press was always full of everything around Corona and how it affected locally, but also in the area generally in the whole country. But it gave also us the possibility to speak about what we are doing, why we are doing. So we set up special elements, special instruments like JAMA, which is it's a platform where it's an in-house platform where we inform about all ongoing and things which are important to every helper, to every volunteer, to every employee. But we also could serve some live question and answer events on this platform, so that professionals, specialists, doctors, whoever were able to give to stay there and give answer to the questions of everyone. So that was also something which was very well accepted and gave us all the spirit that, yes, we are a huge team, we all depend, we take care on each other. So that was, I think, very, very important. It also was important that we, through these platforms, we were able to give services and via stream and to provide them to everyone who did not want to attend, let's say, his own service via stream, but who could attend it via our Frau Georg Längerke, which is a professed knight and priest in Germany, who provided full services around Easter, so everyone could attend this. So we felt more at home. But we also used these platforms to give tutorials, how to do different things, give reminders, give repetition of things which are perhaps in the course of the time we start to forget, but also, let's say, nice and little issues like send a smile, stay home and pray, just to give them always, every now and then, an information, be in touch with everyone, so that no one really felt alone or had to think that no one's taking care on him. And if I now come to my last slide, this is much more what affects my dealing and what my thinking, because it's, yes, everyone in the world, all of you, wherever you are, you have been trying to get along with this critical situation the best you could. Same did we. But what have we learned out of that? What can we improve for the future? This is what is most important, because now we had perhaps a pandemic which was serious, but still it was not something which was really, really hard. If we imagine in the Spanish flu 100 years ago, killed, I think, something like 50 million people. Imagine a virus of this dimension today, it would kill hundreds of millions of people. So we have to learn from this, hope that we're seeing an end, not yet, but hopefully in some countries. But what can we learn out of that? And for me, one of the things that we have to learn is that we clearly see that the national capacities are not prepared in terms of hospitals and rescue and relief, etc., are not really prepared for such a situation. So we have to raise attention on public. We have to talk to our friends, our politicians, whether it's locally or in the area, regionally or federally. We have to talk to them and try to bring awareness that we have to prepare better for such a situation. The second, that goes directly hand in hand, is our works everywhere around the world should be part of this solution, everywhere. And so we have to create awareness not only at the politicians, but also in the public, that what we are doing, and this is not, again, not a question of size. It's a question, it's just everybody is giving an effort. And are we really able, are we part of the solution? For instance, in Germany, I can tell you we have about 6,000 volunteers right now in charge, but we have more than 40,000 volunteers who are sitting at home and who were not able to be part of, to help. And this is something which, for me, it's a nightmare. These people, they are willing, they are trained, they are prepared, but they cannot be part in helping and bringing a solution. And so we have to think, how can we form part overall, locally, regionally, or federally in a country in the help of such a catastrophic situation of a disease, or it might be also something different. We cannot have such a huge reserve of staff and not make use of it. So, and now I'm coming back to the point 3. We have to rethink our services, our volunteer actions. It's fine what we are doing, but is it enough? On the slides, you see on the top right side, you see a little word which it says "weil Nähe zählt," which is a sort of a slogan of our works in Germany. So it means, translated more or less, because closeness is what counts. So we want to be close to the sick and to the poor. But I really feel bad when I think that 80% of our volunteers, they could not be close to the sick and the poor. They were forced to stay at home. They did something. They did some telephones and they were sewing some face masks, but they could not do what they really wanted to do. So we have to think, what can we do? Can we redesign our services so that in a future situation like this, we can affront better the sick and the poor? We have seen in Germany, for instance, in the area of demens and hospice, they were in the past time, they were a little bit, doing an extremely good and important job. But all of a sudden, they were out of business. They could not take care on the people with demence. They could not take care in hospice issues because they were no more available. So we have to rethink, is the way we do hospice, is it that way enough? Or should we also have a plan B if we cannot be at the site? So this is what I'm trying to say when I'm talking about lessons learned, that we rethink our services and always have a plan B. And the last point I'd like to mention is that we also redesign our spiritual part of our mission, that we have to support members and volunteers as well, but for sure the poor and the sick, also via electronic media. Initially, it sounds a little bit strange, but you can get used to it, and in times when all of a sudden we are no more able really to travel, to walk, to go, to visit, and we are condemned to stay at home, but we still need areas and places for mourning, for grief, for receiving condolences. So there I would heavily and strongly recommend that we redesign this area as well. Yes, I think this is it for the time being, and it's enough a little bit an overview of what is happening in Germany.
Well, that was an extremely inspiring romp through the activities in Germany, and I think we all are impressed by the creativity of even the attempts and steps you've taken so far to really redesign some of the services in response. I think it is fascinating that we have all been forced onto these new platforms and how quickly we've adapted. And I think that does indicate, to your point, that there are opportunities here. I know there's probably a lot of questions out there, but I'm going to ask the first one. Just a very, I'm curious about what was in the emergency kit for priests.
You may be very astonished, but it was basically a face mask, a full 100%, how do you call it?
PPE, essentially the gown.
Yes, exactly, and gloves, so that he for sure was fully protected. Glasses, everything. So that was very simple, but we had provided it to him, so that there was for sure nothing that because it was really a critical situation at these times, in these moments where he had to go. For sure, there was a lot of coronavirus everywhere around.
That's a great idea, and I have no doubt that the priests really appreciated the care that was taken to make that available to them, so that they could perform this desperately needed sacramental service. That's wonderful. Now, I know Mariana Balfour has a question for you. Mariana? You might need to unmute.
Yeah, who?
Okay, sorry, I'm using my phone, so it was a little bit more complicated to unmute myself. Yes, well, thank you very much, President, for this very insightful and very informative explanation that you gave us. I was very interested in learning more about the communication aspects, and in particular about this communication hub that you mentioned. So this was my first question. It's true that then you actually spoke a little bit about it during your presentation. So my question would be a step forward. Is there anything else that perhaps was implemented communication-wise? What were the major issues, the major problems that you found in this attempt to implement a better communication? And my second point is not really a question, but it's an idea for the future. I think any crisis is always a great opportunity for growth and for better understanding in every realm, and in particular with communications. So I was wondering, could we perhaps envisage some form of sharing of best practices, of lessons learned for those people who are in the front line in communicating with the outside world, what the Order of Malta is doing in moments of emergencies and crisis? Thank you very much.
Thank you, Mariana. Well, first, the communication, it's not that we had everything prepared. We just started the way we thought it could be useful. So initially, then I said, okay, we are all a little bit scared about the overall situation, about the consequences. No one's knowing how it's going to affect that in our life, in our customs, in our habits. So this is why we started and just informing, as I said, for instance, just saying that we are here and we are here for everybody, and informing what had been done, so that we had this emergency task group set up. What was the function of the emergency task? How did this group had to operate in the different sectors? And so that was initially. Then we said, okay, we have to give more detailed and more specific information. And then we let's say we went more into details and explained on which area specifically what was going on, starting from the general situation, and then going into our specific situation, and then within hours going into the different areas. So we started very simply, and out of that, at the end, we have now a full plan. So on Friday, it's the president's letter. On Monday, it's the CEO's letter. During the week, it's 2-3 times that there is a podcast. On Wednesday is the Q&A session. So all that started by let's say, by learning and seeing what is well accepted. And today it's ongoing and it's wonderful. And then we understood, we see that there is a problem because people they feel so bad and no one's helping them in a serious and critical situation, and they are full of
anxiety and
yes, they are insecure and they don't see a way out. And so we set up, okay, we'll have to set up these helplines. And so many things we started. Then we shared the prayers. We always sent, we set up this platform, JAMA. Initially, we had, I think, 3,000 or 4,000 users. Today, I think we have 27,000 users on JAMA. And so it is very easy for us, but it took us also some technical support to set it quickly up. But we were able to set it up, and today we easily can reach many, many people, many volunteers, many members. All of a sudden, one of the volunteers, well, he's a priest, but he started sending, sending a daily, let's say, exegese, a little comment on the gospel into the JAMA platform. So all these things, we did not have them prepared. They started just by accident, by seeing where's the need and how can we help. And I think that was the way. And yes, today we have a sort of let's say, a matrix, and everyone, or it's not everyone, but let's say that's 5-6 people who know exactly when there's their turn, and they have to come up with an information. We will see how long that will last. We don't want to bore the people, but also I think what the volunteers members and employees always felt that they are very close, very in touch. They are very aware of what's going on, so they felt part of the family. They felt that they are really in the whole action plan, what Malteser is doing. Your second question, I think it's great, but I would address that better to Lisa, because this initiative to share together the experiences can perhaps in the future then go on into an exchange of best practices. So that, I think, is a wonderful idea. Thank you for this idea, Mariana. But that could be a result out of this instrument that we are having.
Let's take that as a homework item that you and I can tackle together, Mariana, and anyone else who's participated in these calls. I have to say that we've gotten an overwhelming positive response from from everyone participating. There's no doubt sort of a pent up, I think what Georg explained, this pent up desire for us to help and be sharing and working together is something that we can harness in a way. And Mariana made the point when she began her question that there's such an opportunity in a time of trial like this. And I think we also distinguish ourselves and define ourselves as organizations, and how, it's just so crucial to be on the field. I've been, extremely humbled really by Georg's repeated openness about how they work organizationally. That for such a vast organization that does require some different levels and various management, that you can remain so open to ideas and learning, and most crucially, to allow people to participate on kind of an ad hoc basis, that those organically come up and people are allowed to just take the field in the way they know best. There isn't a lot of constraint. Can you speak a little bit further to that? I think, it's one of the things that really strikes me, the few examples you gave, but just that the openness in the organization.
Perhaps I did not get right what it means now to say, the openness of the organization.
Just really the entrepreneurial spirit that you have in the organization to let ideas flow up and for people to take the field as they know how.
Well, perhaps it is one of the reasons is we have different boards, and there is a huge team spirit in these boards. So although we have a clear, let's say, a president of the association, which is Agi Lobkowitz, we have CEO of the works, who is Elmar Pankau. We have, a president of Malteser Hilfsdienst, this is me. But every one of us has a board. And so within these boards, we try to encourage everybody to bring its ideas. And the more we delegate the responsibility to the others, the more we receive. So I think this is why, for me, it was perhaps a speciality, because I came up in 2018 after Conny Brandenstein, who had built up Malteser Hilfsdienst to what it is today, and he had been doing that for 26 years. So I thought it's impossible to follow Conny Brandenstein. But then I quickly learned, definitely, that it's one of the most beautiful jobs you may have, to be president of Malteser Hilfsdienst. But what I learned is that I have a complete different approach than Conny Brandenstein did. And Conny Brandenstein was extremely creative, and he doing everything himself and giving new ideas. And I knew I don't have this experience, so I was forced to share with others. And like this is what came out. I don't know, but perhaps I lack on what Conny Brandenstein did have for many years. But on the other side, I have the luck that I have a wonderful team with Albrecht Krui, Dizzy Bernstorff, Vincian Westphalen, and Peter Deselas, together with the Presidium, that we interact so well that we really produce good ideas.
Fantastic. I think Daisy Pictet has a question. We have time for just
Stefan
one more.
Ronka as well is having a question.
Okay, Daisy, and then we'll get Stefano in.
Can you hear me?
Yes, we can.
Yes. Okay. Yeah.
Yes.
Hello. Good evening.
No, I lost
And
you.
thank you very much, President, for your very, very interesting. No, can you hear me? Can you hear me now?
Yes, yes.
It's okay. I don't think the President can. Yes. Thank you very much for the very, very interesting presentation. I learned a great deal in these discussions because, as you know, we are trying in Geneva to ensure that the World Health Organization, the High Commissioner for Refugees, the International Organization for Migration are all fully aware of what the order is doing around the world. Of course, Germany is one of our important flagships. We had a long talk, had a long brief with the WHO. There was a big discussion how important it was for us all to exchange good practices and especially to create new partners so that such a pandemic could be dealt with in a Mr. President, there are two questions regarding Germany. In your recent experience, did you have any problems with access to medical equipment? Because that is what many of my colleagues tell me their countries are having. And my second question is, have you been cooperating, apart from cooperating, of course, with all the local and national authorities, have you also been cooperating with other non-governmental organizations or institutions active in this field in Germany? Thank you very much.
Thank you for your questions. Because it is really important also to talk about that. You know, everybody thought, well, Germany for sure has everything. No, we had nothing. And we had not sufficient masks, we had not sufficient test capacity, we had not sufficient nothing. So we all had exactly the same difficulties that everybody else had. And on top of that, and I guess the same experience you had in everywhere around the world, in such a moment, everywhere came up new ideas, good friends with good alternatives, and importing from China and this and that, and that was very critical for us to organize that. And it took quite a while till we were able really to provide sufficient equipment. This is also why it was difficult for us initially when the virus started to equip our own staff enough. Today we can say we have for about in some specific items 4 to 6 weeks, and in others we have 10 to 12 weeks sufficient stock. We were able to also to help some other countries with some stuff where there was a strong need, but it took us a while till we had that organized. So that was, I guess we were in the same situation than you were. We were trying with good contacts to the big companies and groups in Germany, where we thought we might have a good access to get, I don't know, some of our needs covered. And we had to learn that that was very, very difficult. At the end, we had to produce our own disinfection material. We had to start sewing our own masks and to build some very simple cover from plastic cover from for the faces initially. Today, now it's working. Now we have the whole the purchase department is working nicely and good, and so we have sufficient stuff. But at the beginning, it was very, very difficult, and that affected to all of us. So not only Malteser, also the other relief organizations had exactly the same situation. And they, in part, they were even worse because they did not have a centralized purchase department like what we have. The Red Cross, for instance, which is, let's say, 4 or 5 times larger than we are in Germany, they have no centralized purchase department. We have. So we had, even there, we had a little advantage, but they had the same problems. This gives me another issue to a question you may have asked or not, but I just want to talk about that. We have been informing within our organization about what was going on in all the works of the order around the world. So that was very important for us to create a new spirit in our members, volunteers, and employees, seeing that we are part of a huge, huge family. And this huge family is having also similar problems that we have. So I think that was a very important moment for all of our work in Germany, because in the future we will have much more to talk about solidarity. And it's not that not only, yes, for sure, that the rich help the not that rich ones, but that we have to share much more, and we have to fight together much more. And this puts me to the conclusion, and that is, I think, by sticking a little bit more together, and this is why it's not a question of size independently, but sticking together, everyone in his country, and being part of a huge worldwide organization, a relief organization, we can try to bring us at a higher level. Talking about the experience in Germany, relief is a question basically done locally and in the area, so the province, financed in part from federal authority, but it's done locally. But we have been discussing inside why, and we are having a crisis which does not stop at any border. So it goes around everywhere, and it might come back again. So do we have a network at European level or at a higher level? A couple of years ago, the Grand Hospitaler had an initiative of relief organizations managed by the United Nations. It was a huge congress. I remember first in Geneva and then later on in Turkey, and we were part of the Christian, I think of the Christian relief organizations. But I think we should focus more on that, because we are a huge organization. We have many, many, many members. We are doing a very important work, but perhaps we do not speak sufficiently about it. Perhaps we do not join all that to have with one voice and bringing up our experience, also our needs towards the responsible people. And that we should perhaps think of also as a conclusion of all what we are doing, that we make more use of this strength, of this capacity.
Thank you, Georg. I've been very strict on the time limits so far, and I see we're running over, but I want to let Stefano ask a final question, and then Richard Fitzel and Howard is going to lead us in the prayer of the order to close this meeting. So with that, I will call on Stefano. And
Thank you very much, Georg, for your impressive presentation. And at the beginning of your presentation, you gave us a number of elements which synergistically worked in a way that they produced great success. We can say that certainly in Europe, Germany has demonstrated to be the champion of the best solutions. In Italy, we have more problems for a certain amount of weakness, perhaps, and in part mistakes. But as you say, the sharing is the name of the game in these matters, and this is why recently we have launched a platform to share with other countries, having, in the case of the countries we've started with, which is Palestine, first of all. We put together physicians from Italy and physicians from Gaza in the West Bank, together with the help of a think tank, in order to share experience and to make that they don't repeat the same mistakes that we have starting before accomplished. For instance, Gaza is a typical situation where there are very few cases, but if the virus starts there, it could really be a disaster, because for cultural reasons, the density is very high, and they really need help. Now, we're going to continue this experience at the global level with other countries. The next one will be Jordan, and then we'll have Lebanon and possibly Libya, and continue. Now, the problem is that there is a limited reservoir of physicians with a certain experience. And this is why we would be very grateful if you can help us to identify doctors who are ready to participate to this doctors-to-doctors platform. We have already had the contribution, the participation of a group of Italian physicians, but if the association in Germany can suggest us a number of doctors who can participate to this exchange we have started, we would be extremely grateful. Secondly, let us not forget that the virus is hitting beyond the virus. What is going on internally and externally to countries, the tensions that this has provoked, politically speaking. I mean, I have a certain amount of diplomats in this network, in this platform where we are talking now, and they can understand very well what I'm saying. There's already a short supply of food around the world, with a reduction of 32% of the trade. Russia, China, India have started closing their export in wheat and rice. The price of oil is plummeting. There are things which will put the poor and the sick in a difficult condition also beyond the virus. And this is also something we have to think of when we prepare to the next months and years. Thank you very much for what you've done and what you said to us. And I hope we can stay in touch for the request I raised during my presentation. Thank you very much.
Yes, if I just may just say one short thing. This idea of a platform, I think it's a great idea, and I will take it with me and discuss it. Perhaps we can have it also discussed with Malteser International. Just that you are aware, we have been trying to send a team of 30 doctors and nurses to Italy, but we were stopped by administrative issues. And there you see why it is so important to address our needs onto a higher level. It can't be true that we want to send a help and we are stopped by administration. So you see how important it is to really focus together and join and put together our questions, our needs, and try to enforce what we want to do. And let's hope that we stay in touch and prepare well, because as I said, I think coronavirus was a serious pandemic, but there can be much more serious pandemics to come. And today we were able to buy food in each store, and so people were able to eat. But what happens if we all of a sudden do not have that? How are we then prepared? So thank you also for this hint, Stefano.
Thank you very much, Georg.
And well, thank you one and all. This has been an extremely lively conversation, and it certainly lived up to the expectation of the 70+ people who joined us today.